mga bedista. Ako si Isabella Apepe at ito ang Tatak Bedista TV, ang tagapagpahayag ng mahalagang balita sa San Beda. San Beda College Alabang welcomes another school year, but as students return to campus, shifting weather patterns pose new challenges to their health and safety.
A series of typhoons, Kryzelle, Dante, and Emong, struck the Philippines, causing widespread flooding across Luzon, including in Muntinlupa. Thousands were displaced, major roads closed, and several areas declared a state of calamity. Alongside the damage, health threats are on the rise. From June 8 to August 7, the Department of Health recorded 2,396 leptospirosis cases nationwide, prompting 19 NCR hospitals to open fast lanes for patients. At Ospital ng Muntinlupa, the 55-bed emergency room treated 98 patients in a single day, 16 of them diagnosed with leptospirosis. With the Bedan community facing heightened risk from the recent rains and floods, we take a closer look at the precautions to protect against two dangerous illnesses, dengue and leptospirosis.
These two diseases usually occurs during rainy season. They are both infectious in nature. In the medical field, if the rainy season comes, we always have in mind that these two infectious diseases will prevail. They have both the same signs and symptoms, although they differ in the cause. Lepto is bacterial in nature, while dengue is viral, but they both present with fever. With regards to the numbers of the lepto and dengue, they are almost the same. The numbers are usually increasing during rainy seasons. And the problem now is there are a lot more of lepto rather than dengue. Dengue starts with fever, but the incubation is shorter. Lepto, on the other hand, also presents with fever, but it has longer incubation period. You can have lepto until 1 month from the time you were exposed. While dengue, you have 2 to 3 days. You can have the symptoms already. And from there on, you can do the examinations na you can detect it. And then, you have to ask the community, is there a rampant cases of dengue?
Dengue is also a growing concern. Over 8,000 cases were reported nationwide in just 2 weeks last July. To fight this, the DOH urges the public to follow the 4 T's: taob, taktak, tuyo, at takip to destroy mosquito breeding sites.
So if they have fever, we always count the days the child had fever. And we also ask history if in the community they have floods there, or if there are any member of the family who have dengue or had been hospitalized and was treated on such illnesses. So if siguro they will go to the clinic first day of illness, then we usually tell the parent na send your child to your attending physician or to your attending pedia para workups will be done. And then, if we see na we have to tell the school na this is the percentage of the patients we have na, if it's increasing in number, then we have to release a protocol or a memo that there is this increasing number of dengue in the school or lepto. So, why is it important na dapat makita sila agad? It's because to prevent complications. With dengue, your complication is bleeding because of decrease in platelet. The complications of lepto is injury to your kidney. So, yun ang gusto natin ma-prevent.
Prevention is just as important as treatment. The San Beda College Alabang Clinic reminds the community to stay vigilant against dengue and leptospirosis, enforcing health protocols that include regular monitoring, health advisories, and coordination with local authorities as part of the school's broader prevention efforts.
At the start of the school year, we always seek the help of the City Health Office to see to it that the whole school is safe for dengue. Although we have to be aware, the community must be aware of what will happen if they encounter such illnesses. We usually place in our bulletin boards the symptoms, signs and symptoms of these particular diseases so that the community will be aware, and lectures on these different kind of illnesses. If you're at home, be sure to take a bath because dengue mosquitoes, they love the sweat. We have to be clean, no? And then wash our hands. Be aware of yung mga waters na nakastagnant lang dyan. Clean the whole environment nung house nila. And with the lepto, for example, it's rainy season, wala kayong pasok, just stay at home.
These preventive measures extend beyond our campus and into our homes, keeping our areas clean, removing stagnant water, and practicing proper sanitation will help prevent dengue, leptospirosis, and other infectious diseases. For more updates, stay tuned at Tatak Bedista TV. Isabella Apepe, reporting.